UK announcing a big increase in the number of deaths today. The country now starting to post figures similar to those we've seen in some of its continental neighbours. The government here was under fire from some quarters for its initial approach, this wait-and-see approach, the idea of seeking to establish herd immunity, something which Donald Trump said as recently as yesterday could have led to disaster. Now, some of the scientists responsible for encouraging the recent change of tack say that these lockdown measures, social distancing measures, are beginning to bear fruit, but it won't be borne out in terms of figures for several weeks yet. A lot of the focus here is on the preparedness of the country's already stretched National Health Service. Unions saying that frontline healthcare workers are not getting the equipment they need. A big controversy also over testing. The country, for example, has carried out a total of about 150,000 tests so far. Germany is currently carrying out 70,000 a day. The government under pressure to deliver on that front. At the moment, about a quarter to a fifth of healthcare workers are off work, self-isolating, and obviously the idea is that they get to know their coronavirus status and can, in many cases, then return to the front line of the fight. Brighter news on other fronts for the National Health Service. There's been a huge effort underway over the last weeks to kit out London's Excel Exhibition Centre as a 4,000 capacity field hospital, the largest critical care hospital of its kind anywhere in the world. That it's hoped will take some of the pressure off conventional hospitals. Similar facilities are planned in the cities of Birmingham, Manchester and Glasgow. The government keen to show that it is acting, that it is ordering new equipment, 61,000 ventilators, for example, but there is still this fear that the government is playing catch-up. They might not be delivered, for example, in time for a peak, which many experts are predicting will happen within the next 2 to 3 weeks.